just so you can see.
Okay.
Easier. Okay, so the trach tube that we would use for most children that are needing to be connected to a BiPAP or CPAP or home ventilator at night would be a Bavona with a flexible extension. So this way, when we connect him to the ventilator, let's pretend this ventilator hooks up, and he rolls around at night and moves. You see how the trach tube stays real still in his neck, and the tubing can go this way and that way, and it doesn't really bother him as much as when he had the connection, on his face. So these trach tubes, I'm going to take it out and kind of show you what it looks like. And this band is a soft band with a Velcro connection is what would hold the trach tube in place. And I'll just take it out real quick. And it comes out right like this. And this stoma is much bigger than it would be for him. For him, it would be just as big as the trach tube. And this is what the trach tube would look like. This is a 3.0 neo trach tube, neonatal, and it has a flexible cannula. This is the part that is inside his windpipe. So it's pretty flexible, and then it's flexible here also. And the tube he might need might be one size bigger, maybe a 3.5. Dr. Pawitsky would look exactly, what type he needs. But this is a Bavona Flex 10 trach tube that we use quite a bit. And let me see here if I have I might have to get another Bavona. Yeah. And I'm going to leave this in place right now. And when he is not on the ventilator during the daytime, what most kids do is when they have a tracheostomy, they put a little filter on the trach, and they come in different styles. This one is one of the most commonly used. It's called an HME, heat moisture exchanger, or nose. It has little filter papers there, and it sticks at the end of the trach tube. And then he breathes through the filter, so he is protected from dust and hair and things like that. So he'll breathe in through, and then he's breathing out through the filter, and all the moisture from his lungs, whenever we breathe out, we lose moisture, like a mirror will fog up. All the moisture will be trapped in here, and he's breathing the moisture back in. So this would be something he would use during the daytime, where he is not really hooked up or connected to anything.
How often are those changed?
These are exchanged once a day, sometimes twice a day.
Does it change a different color when it needs to be, or
no,
look
it
soggy,
just
or
it
wet?
just looks bad.
Okay.
Yeah, and then you'll change it. But this is what most kids use during the daytime. It's pretty easy. You just put it on, and then it filters the air breathing in.
It's
Now,
something he can pull off easily if we're not careful.
yes. However, we have another option, and I have it right here, that if children do, a lot of them will really not mess with it. But I've had a few, and that did.
He's lately gotten a little grabby with his G button.
Pretty good. So
okay.
And you can stick it on there pretty good. But I've also done something in that if it's kind of something he would do. I'm pretty sure I have a picture on here. Stoma protector. Yeah. This little girl was actually one of my patients that kept taking it off and throwing it constantly. We had it. We can't give you that many. We definitely don't want to pick it up from the floor. So this is a specialized foam cover. It's not a bib. It kind of looks like one, but it's not. It's a high-density foam cover that we tie over the trach tube around his neck, and then you can actually tug it in the clothing so it doesn't look like a bib. I mean, of course, a little guy like him, it's not so bad, but when he gets older. But you can tug it under so that it covers the trach, and it does the same thing as this filter. And this way he won't be able to mess with it. That's an alternate option. Okay. Also, I need to go to the closet and show you the other trach tubes. So there's two different kind of trach tube options we can go with. If somebody requires ventilator support at night via whatever mode the doctors feel he needs, this tube is generally better for an active child that rolls and does and whatever, because whatever he does, it does not.
Because I've seen some that are more flush with the neck.
Exactly. I'll show you that one right now.